starting with the past, like, in evaluating patients, we ask about previous suicide attempts and we get details of what the person did and so on and so forth. So in what way can we use that information to try to prevent future suicide attempts?
Yeah, so, whenever I teach about suicide, the way I put it is, when we are evaluating a patient who turns out to be at risk of suicide, and we're asking them, how are you, what's going on now, what symptoms do you have, what risk factors do you have, protective factors, and then we talk about their past. Like, have you ever had suicide attempts in the past? Have you ever attempted suicide in the past? I say it's not that we're asking this information because we're like writing a biography about the patient. We have very, very concrete reason, very concrete, very practical, important reason, and that is, if I could put it as a model, the past predicts the future.
Yeah.
Now, of course, nothing is ever perfect, but what we do, when we start a suicide assessment, we focus on the present episode.
Yeah.
And there are two goals to assessing the present episode. First, we want to get an overall, ascertain the overall degree of risk. Is this person low risk, moderate risk, or high risk, or even like imminent risk, right? And based on that, our kind of level of risk that we assign to the patient, that will lead to a disposition, to a decision on the level of care that the patient needs right now in order to protect them, to keep them safe. But the second goal is also that we are identifying the individual risk factors and individual protective factors, because the goal of management will be to address those directly. Yeah. So we're not only treating a person for major depression and giving them fluoxetine, for example, we are doing that, but we're also going to target the individual risk factors and protective factors that can be targeted. Now, the way that the past comes in is then we have, perhaps for a lot of patients, many instances of either actual suicide attempts or times of previous crisis, even if it did not lead to a suicide attempt, where it was getting close. And therefore, I want to identify the pattern over time of what are the warning signs
for that particular person.
For that particular person, the warning signs that are, especially objective ones, that like my family, my friend, my psychiatrist can say, oh, so when you, all of a sudden you're not sleeping, that's a bad sign. Or all of a sudden when you stop, visiting your grandchildren, that's a bad sign. So I'm using the entire history to identify the warning signs, meaning that the patient is going downhill, they're decompensating, they're falling into a crisis. And then also I'm learning what the triggers are.
Again, they're different for different people.
They're different for different people.
So what are the triggers for this particular person?
Yeah, I mean, I remember one patient I had whose suicide attempt was triggered by the fact that he was, terminated from his job. And yet I remember, that same week in my career, I had a patient who, for him losing a job was sort of like no big deal. Like it's just so like, either they're going to fire me, I'm going to quit, or I'm going to tell the boss he's an SOB. So, it's in, the triggers are going to be individual for that person, and I want to help them and myself to identify what they are. Now, for a lot of people, there are going to be like some interpersonal rupture. So, a person who is, their girlfriend or boyfriend breaks up with them. Their spouse, files for divorce. Some kind of interpersonal rupture or abandonment. And then often, especially if it's associated with increasing intoxication during that time. So the person is despondent, they're intoxicated, and they may actually then...
So this is an example of triggers for one person.
That's right. So kind of like, for that one person, it may be the combination of an interpersonal rupture together with, getting intoxicated. It kind of like, it increases their impulsivity and they go ahead.
I get it.
Yes.
So look for patterns, because the same pattern might repeat in the future.
Now, to kind of highlight, so everything from the past until the present moment that I'm meeting with the patient right now is I'm getting that information to help me decide the future. the upcoming future, like what's going to happen when this patient leaves my office.
Yeah.
So the very, like, the very short-term future, but also the longer-term future. So for a lot of patients, they may come in to see me and they have maybe a history of either, suicidal crises or actual suicide attempts. Right now, they might be, if I ask them, they might be saying, no, I'm not having the suicidal thoughts right now. I'm not having any kind of plans. I'm feeling pretty good right now.
Right.
I will not stop there. I will then ask them to help me understand the future. So I'll say something like, well, what do you think it would take for you to get back into that bad place again, where that crisis may reoccur, or that you may want to, you start thinking about taking your life? What would it take? And Raj, what amazes me is two things. How infrequently we as psychiatrists ask that question.
Yeah.
And the second thing that amazes me is how frequently patients they come up with an answer like this. It's like they know. They've been thinking about it.
Yeah.
It's almost like they've been waiting for someone to ask them this question.
Right. I've heard you refer to these things, the future assessment, as like hot button triggers.
Right, so
worst case scenario, end of rope scenario. Can you explain, like, what do these things mean?
Sure. So, one way of phrasing that, like, so what are your, the hot button issues that can really hurt you?
The particular ones.
Particular ones that hurt you that may, again, trigger.
Yeah.
And I don't always say, suicide attempts, but I say, that will trigger these crisis times again for you. These much more difficult times for you.
Right.
So, and the patients can often say, well, yes, again, if my girlfriend or boyfriend breaks up with me, or if I fail out of school, if I lose my job, and then I won't be able to pay my mortgage. So people can often, identify those. Another way of putting it is worst case scenario.
Yeah.
And